Good morning. Today I want to talk to you about hyperglycemia and what to look for in these things. One must understand that when we talk about hyper and hypoglycemia, it could be caused by many different things. But the first most important thing to understand about hyper or hyperglycemia is understanding what insulin is and what role it plays in regulating the balance between the insulin and the glucose levels in the body. Okay, when we look at insulin, we must understand that insulin is actually just the key. It's a simple key that unlocks the cell membrane. Just goes in. It's a simple key. Let's get this working. Simple key that unlocks the cell membrane and allows the glucose to pass through from the bloodstream into the cells, and enables it to use it as energy, food, or eventually to be stored as fat, maybe even. Now, before we go on, I just want to ask you please to like, share, and subscribe if you enjoy the things that you see here on my channel. It's merely for entertainment purposes. It's actually for my students who are busy studying for my courses and things like that, emergency medical responder. So let's go on and now talk about these things. Firstly, it's an imbalance in glucose. Diabetes is an imbalance between the insulin and the glucose in the body. Like I said to you, the key is insulin that unlocks the cell membrane, allows the glucose to pass from the bloodstream into the cells and use it as food. One thing we've got to remember is it can either be high, either in hyperglycemia, which has many different effects on the body, or it can be very low, like as in hypoglycemia. Now, when we're looking in South African terms, the HGT, your average reading when you do HGT test is between, let's say 4.5 and 6.5, just to be on the safe side. So when we check these things, we check to see, is it high or is it low? Now, when we look at hypoglycemia, low is anything 2.5, 3. Anything below 2 is deadly. Your patient will be going into a coma very shortly. Anything above 8, 9, 10 on a regular basis is really starting to become out of hand and needs to be looked at. So if we talk about the normal glucose levels between 4 and 6, and we talk about low as in 3 or 2, one can see that it's a very short distance between 4, 3, 2. So the quick reaction it has when it takes on this low glycemic index or low hypoglycemia can be very quick. It can be a matter of half an hour to sometimes about an hour and a half, 2 hours, depending on the activity, depending on what the patient has had to eat before the time, and depending on how well his insulin levels and that are controlled. Whereas if we look at hyperglycemia, high blood sugar, it could take weeks, days, weeks, even months sometimes to build up to such a level that it becomes a dangerous level. One thing we've got to remember that the signs and symptoms of what we're looking at are completely opposite to each other. If we're looking at hypoglycemia, which is very low, like as in 2, 2.5 on the HCT, if you do a little simple blood finger prick test, your HCT at 2 is going to have signs and symptoms like pale, cold, clammy skin, especially in older people and people that are really bad with diabetes. Could be slightly moody, maybe just a bit aggressive type of thing, nausea, maybe even vomiting. Whereas your hyperglycemia, your very high, is going to have your red, flushed, dry skin. Okay, most important to remember with your hyperglycemic patients is they're always lethargic, they're always tired. Okay, sometimes their cheeks and that are when we flush, their skin looks very dry, okay, and red. Always thirsty. I think it was the CPs, polyphagia, polyuria, polydipsia. Eat a lot, drink a lot, and pee a lot. Polyuria. Okay, if you fall into these categories of eat a lot, drink a lot, and pee a lot, then you know that your sugar is out of whack. Your glucose is not looking good. Okay, especially because you're thirsty. You can imagine you eat a whole slab of chocolate. Anybody eats a whole slab of chocolate. The first thing they're going to reach for after a whole slab of chocolate is a glass of water. Because the sugar is so high in their system, it's crazy high, they need to try and dilute it. Now with a diabetic, you've got this constant high sugar levels in your body. And all the time you're trying to dilute that sugar, so you're drinking more, and you always end up peeing a lot more, polyuria. Okay. At the same time, your body's telling your brain, listen, I'm not getting food. My cells are starving here. I just can't do this thing anymore. I need to eat. I need to get sustenance into this body. And then your body starts to, you start to crave. You start to eat a little bit extra here and there and things like that. Now you must remember, a lot of people say you need to eat 6 meals a day, or this, and small meals, control your sugar intake of fruit and carbohydrates and things, especially refined carbs and starches. Definitely can affect the amount of glucose in the blood. At the same time, simple fasting and in between things like this can actually help to bring it down. But you must remember all these things must be done in conjunction with a doctor. Under no circumstances do any of my videos ever replace the need for a good clinical examination, evaluation and things like that. One has to understand this right from the start. Always seek the professional advice from a healthcare practitioner, a good healthcare practitioner, one that takes the time to check all your vital signs, HTT, respiration, pulse rate, heart rate, everything. Make sure that your doctor always, or your nurse, or whatever the case might be, always checks everything each time you go there. Not that they cut it short and they don't do this, don't do the next thing, because that's when you start to have problems. One has to remember that with diabetes, and let's give you the scenario. A young man is at gym. He's a diabetic. He's a type 1 diabetic. He always has to have his little bits and pieces here and there that he eats and things. So one day he goes to gym in the morning. He has a slight snack before he goes to gym after he's woken up, increases his sugar levels slightly, and off he goes to gym. He has his insulin and he burns all the sugar and everything that he's had. All that glucose that's in his bloodstream is now depleted. On his way to the changing room, he meets an old mate that he hasn't seen for 2 years. So they stop and chat. Chat moves into 15, 20 minutes, and all of a sudden this guy remembers he's late for his appointment. Off to the shower quickly, runs through the shower, runs through the spray bottle, grabs his clothes, ducks back to work, and on the way to his meeting, he passes out in his car because his blood sugar levels are so low. He's used all the stores in his body, and he has an accident, and it's end of story. He's injured, he's dead, he's very sad and tragic. Okay, all because the glucose levels weren't monitored, they weren't replenished, they weren't available for his body to use. Okay, this could take half an hour, 45 minutes, depends how unstable his glucose level, his insulin levels are, and things like that. These things that must be remembered. The opposite side of the coin is with hyperglycaemia. One will sometimes see that one is thirsty all the time, one is tired all the time, one is drinking a lot of fluids all the time. Okay, this isn't uncommon, especially if you live in a hot, dry environment, but it's exacerbated by this lethargy, this tiredness the whole time. One has to remember that glucose builds up very slowly in the body, in the bloodstream. It can't be used because the insulin can't unlock the cell membrane to allow the glucose to pass through and be used as food. So you get this tiredness, this irritability all the time. Okay, people most at risk with these type of things are your elderly folks. Okay, they don't even understand they've got diabetes half the time. The other half of the time they forget they've taken their medication, or whether they double dose. If they're on insulin injections, they double dose on the insulin injections, and that's when the techie hits the tar. One has to always be careful for these type of people. Type 1, type 2 diabetics can generally control their glucose levels by fasting and eating responsibly, good healthy meals, low in carbohydrates, ketogenic if possible. It's always a possibility to do things. One has to remember that these things are always going to be with us, especially if we're diabetic or inclined to diabetes, whether it's just the beginning or whether you're a full-blown diabetic already. One must always check these things. Now I'm going to ask you again, please like, share and subscribe if you viewed this video and you found it useful. I know a lot of people overseas are watching these videos of mine. Not sure what you're studying. If you're studying, if you find them helpful, please leave a comment. And let's just get the word out there. This is by no means a clinical diagnosis program. This is by no means an excuse not to go to the doctor, not to go to the clinic. This is merely for educational purposes for my students. Or anybody else watching, you're welcome. If you have any questions, any comments, please leave a message afterwards. And by all means, please, but whatever you do, don't ever not go to the doctor. If you're feeling lethargic, if you're feeling thirsty the whole time, your skin is flushed and dry, or if you're crabby, aggressive, you feel like your sugar's up and down the whole time, go to a healthcare professional and go get it checked out, please. Even if you go to a pharmacist and get them to do a check for you for HGT or whatever the case might be, you don't know what it's called in your country, but always be aware of the possibility of diabetes. Thank you for everything. Go on.